why you don't need antibiotics if you have a common cold.
What?
I'm telling you.
Are you sure?
I'm not sure. So I've got an infectious disease specialist here, Dr. Tom Warren, who's going to explain to us the difference between a virus, a bacteria, a cold, a bacterial illness. I'm Dr. Paul Zalzal.
I'm Dr. Brad Wing. Welcome to Talking with Docs. And the other thing is, the reason to not do it is not just for your cold, it's for the greater good of all of us. So stay till the end, and we're gonna tell you kind of how to approach this. Welcome, Tom. Let's start at the beginning. How crazy does it make you when people say, listen, I want antibiotics because my kid's got a runny nose?
Yeah, so antibiotics are medications that treat bacterial infections.
Okay.
So it's bacteria that are affected by antibiotics.
Okay, so I'm a mom. So I'm like, well, how do you know that my kid's runny nose is not a bacteria?
Yeah, so viruses are very common.
Right.
We all have several viral infections per year.
Okay.
And so most of the colds and flus that we have are due to viruses.
Right.
And most viruses don't have medications that treat them. There are some that do,
Sure.
But most don't.
There's a key difference between a virus and a bacteria. They're both germs, I guess you would consider them. A bacteria is a living organism. It's a one cell, it's not even an organism, it's a one cell living thing. Okay, it lives on its own. A virus doesn't even meet the definition of a living thing, I don't think. It's basically like a protein inside some kind of shell. It's not a living entity on its own like a bacteria. They're two totally different things. And viral infections, thankfully, are much, much, much more common than bacterial infections in the general population.
That's right.
Fair to say?
That's right.
Coming from not an infectious disease specialist.
Sure, and the way antibiotics work is a very specific mechanism that attacks a very specific part of the bacteria that make it die or reduce its effectiveness or whatever. But those similar strategies don't work against a virus.
So an antibiotic will not kill a virus.
That's right. An antibiotic has no effect on viruses.
Take home point number one, antibiotics don't work for viruses. So as a clinician, so a child comes into your clinic, maybe not your clinic, but even a family doctor's office or a walk-in clinic, they have a runny nose. Like how do you know it's not a bacteria? Do you have to test like the exudate, like the runny nose, or swab the ear or the throat to know that it's not a bacteria?
There are some tests for bacteria and cultures that we can do, but we just know based on how common viruses are,
okay,
and the symptoms that someone has, that it's most likely going to be a virus. And so we know for things like sinusitis, for instance, that can be caused by bacteria, but is often initially caused by viral infections, that we can wait. We can see if the person is going to get better, like most people frequently do when they have head colds. The runny nose will go away after a few days. The cough will go away after a few days. And so there are some people where it won't. And that's when we can start doing potentially more tests for bacteria.
And saying it looked like a virus, but the way it's behaving now, we think, it might be a bacteria.
That's right.
Well, we have antibiotics for bacterial infections. Why don't we just give people antivirals for these virus infections?
That'd be great. We just don't have those medications, and there's a variety of reasons why. One of the main ones is that viruses just change so frequently, and so it's a cat and mouse game. And we've seen that, with other viruses that we potentially can treat, like COVID or influenza. We do have some medication for them, but they're not perfect. And so antivirals are, in general, a little harder to make.
Okay, so I'm a parent. Little Jimmy's got hockey playoffs next week. He's kind of got a bit of a runny nose. Is there any downside to just giving him some antibiotics just in case, on the 1% chance that it's a bacterial infection? Because I need him good for Saturday. He plays center. He's going to the playoffs. Can we not just give him some antibiotics?
Well,
the cost is low, right?
Well, there are definitely side effects. So
okay, let's talk about the reasons not to take antibiotics willy-nilly.
Yeah, so there's definitely side effects for the patient themselves.
Okay.
So antibiotics, can cause toxicity to different organs like the kidneys.
Yes.
People can have allergic reactions to them.
Right.
And they can kill some of the good bacteria that are in people's bowel. And those good bacteria on the skin or in the bowel can have a protective effect.
And we have learned lots of, I'd say in the last 10 years, the microbiome has just really popular thing to talk about. And we've learned that there are consequences to killing the good bacteria in our gut. So there's 3 good reasons. What about the financial cost? Say you don't have benefits. Like, are they expensive?
Yeah, some antibiotics are very expensive. There are lots. We're using things like penicillin and amoxicillin that have been around for decades, so they're not that expensive anymore.
Okay.
But some antibiotics can be expensive. But
Okay.
the other main risk is that the antibiotics can select for more resistant organisms.
Okay.
So the antibiotics are just killing bacteria that are susceptible to them, but there's going to be lots of other bacteria around that aren't susceptible, and they're usually more resistant and harder to treat.
Right.
So by taking antibiotics, you're actually screening for the more resistant bacteria because they're going to no longer be fighting the other bacteria, competitive inhibition it's called. So if you kill off a whole population of bacteria, other bacteria are going to thrive, and those bacteria might be harder to treat with antibiotics.
That's right.
I like the analogy of using a herbicide on your lawn, right? That kills most of the weeds, but one weed survives. And then that weed, like you said, slowly just takes over your whole lawn.
Right.
So you have to be careful. So that's the first problem with taking antibiotic cleaning. Is there a problem that eventually, if you don't take the right dose or take it for long enough or don't target it well enough, that the bacteria can learn how to evade the antibiotics that we have?
Yeah, so bacteria can develop resistance.
Right. And would you say that this is a significant problem in our world today?
Very significant.
Right.
Absolutely.
And like life-threatening, potentially like world-threatening. But I think we don't really appreciate this. The average person that just wants to take antibiotics for 5 days to make their runny nose go away doesn't realize that this could lead to a bacteria that could kill millions of people. So why is this important and how does it work?
Yeah, so as bacteria are exposed to different antibiotics, they select for resistance. And so it's only the strong that survive. And so
Thank you, Darwin.
those bacteria that develop resistance are going to grow more and spread more.
Right.
And we've got to realize that when we take antibiotics, they eventually make their way into the sewage system.
Right.
We excrete them, and we can find antibiotics in lakes and rivers and things like that. And so,
Side note, never put your pills in the toilet. Never flush them into the water system. Return them to the pharmacist. Sorry, I just had to say that. Okay, so they're everywhere. So, and we're giving them to animals, right? We're not uncommonly feeding them to chickens and cows and pigs to prevent disease. And I think I read a stat like 80% of the world's antibiotics actually are consumed by animals, not by human beings.
that's right.
Which is very concerning.
Okay, so then this presence of antibiotics everywhere is helping these bacteria evolve to become resistant to the antibiotics. Give us a name of like just 3 super bad bacteria that we just can't treat well with antibiotics, just so people can Google them if they want.
Yeah, so MRSA is a big one.
Okay,
so
yeah.
methicillin-resistant Staphylococcus aureus.
So Staph aureus, very common, lives in the skin, lives everywhere. But there's a specific brand of that one that's extra strong and hard to treat.
That's right.
Okay, so MRSA.
And then there's bacteria like E. coli and other similar bacteria, gram-negative organisms that can become very resistant as well.
Okay. So this is why you might have a loved one or know someone who died from overwhelming infection because they may have had an infection with one of these bacteria that we can't treat. And this bacteria came about because we've been over-treating bacteria with antibiotics.
Yeah.
Yeah, we're seeing this in common infections like salmonella infections in different parts of the world are extremely resistant. We have almost no drugs to treat it. Gonorrhea. There's many common infections that are just becoming more and more antibiotic resistant because there's more and more antibiotics being used.
And then when it comes to survival of the fittest, literally we have no medication for you, so it's either your body fights it or unfortunately you succumb.
That's right.
It takes us back to hundreds of years ago before we had antibiotics.
Yeah, and antibiotics take a long time to develop. It's very expensive. It's, $1 billion to develop a new medication.
Right, and we essentially cannot react fast enough to the rate at which it's changing right now because of the 8 billion people in our world and the amount of that's being used.
That's right. So we have to use the precious resource that we have, antibiotics, in a logical way.
Right, so physicians and patients need to be stewards of this, essentially.
That's right.
Protect it.
Okay, so just quickly, what are some of the key features now? Now, I know taking antibiotics is bad. I have something going on. What are like the key things that'll tell me this is a virus or maybe this is a bacteria and I might have to take antibiotics? Can you think of a few key symptoms?
Hard. That's a hard question.
Yeah, that's hard. But, for a lot of the common viruses that we have, people have experienced these. We all experience them a couple times a year. And so if it's something that is progressively getting worse,
Okay.
if it's something that's not going away,
Right.
if there's a high fever,
Really high fever, yeah, sure.
or people are just feeling very unwell, they're just not able to work, they're not able to get out of bed, those severe features. But for most of the common runny nose, kind of sore throat, the usual kind of aches of flu and, head colds, those are going to be viral infections.
Okay, and now let's say I do have an infection and it is it is actually a bacterial infection in my throat, for example. Is there a chance that my body can get over it without antibiotics, or do
That's a
I
great
100%
question.
definitely need antibiotics? to
Like
get
if
rid of
you're anti-antibiotics,
it? Yeah.
if you're like, no way, I'm not taking that.
Double anti.
Double anti.
Yeah. So, our immune systems are wonderful things.
Yes,
And,
thankfully.
yeah, the body has an ability to fight off infections, including bacterial infections.
Okay.
So whether it's sinusitis or ear infections or pneumonia, there's definitely a possibility that we can fight those off without antibiotics.
Okay. So you've got time before you have to jump into the
Absolutely.
antibiotic thing. Definitely see your healthcare provider if you're feeling unwell, but just recognize that if your healthcare provider does not give you antibiotics on that first visit, they're not being mean to you.
Agreed. And I think that people think it's like a conspiracy
It's a
against
bad
them.
doctor. Yeah, it's not. The reason is because it's that your healthcare provider thinks you probably have a viral illness and thinks you're probably going to get better without the antibiotics. And the reason we're not prescribing antibiotics willy-nilly, as you said, is for the reasons we talked about, the bad effects on you and the bad effects on the population.
It's kind of like the crying wolf story, right? You don't want to use them, and then you finally need them, like, well, they don't work anymore.
Yeah, that's right.
I think the other thing we'd be remiss not to talk about with respect to antibiotics is C. diff. So Clostridium difficile is a very specific, unique infection that happens to people. Often, they can even after one dose of antibiotics potentially, and this can be very debilitating, even life-threatening. So this is just another reason along the long list of reasons not to take antibiotics when you don't need them. Sometimes you take them and you still get this, but that part's unavoidable. So yeah, the take-home message is only take them if you need them. Listen to your doctor. Don't be mad at your doctor.
Don't get mad at it.
Leave a comment if you have an experience with antibiotics or negative, positive, whatever your thoughts are. And if you like this video, please like and subscribe to our channel.
And remember, you are in charge of your own health.
And thanks to Dr. Warren for explaining this very complicated subject to us.
Thank you.
See you next time.